Many clinicians are others focused. They tend to overextend themselves because they feel so called to help others. This is a worthy cause, but it can create challenges that shouldn't be ignored. So, before we begin, ask yourself, how could offering intensives change your life for the better? Dream a little and ask yourself the tough question of what needs to change for you to be the healthiest version of yourself. This is an important step before we tackle the tough topic of taking breaks and self care practices. Take Joe, for example, a colleague that pushed himself so hard that one day he found himself in the hospital with more questions than answers, needing a 9-week sabbatical from work, feeling mostly in a fog, and having no income during that time because he hadn't anticipated what compassion fatigue might do to him personally. Like Joe, many don't realize the toll that work is taking until it's too late, and some set of consequences have already set in. Joe told me later that he wished he had taken more time to consider himself, and he also reminded me that when you're in an airplane and the pilot says, if the oxygen masks drop, put yours on first before assisting others. What a great metaphor to encourage us to practice what we promote. The most important thing to start with is you and your own self-care. Anecdotally, we know that rest is necessary for both you and your client's well-being. It's important as clinicians to practice what we preach. If we want our clients to be healthy and balanced, shouldn't we strive to be healthy and balanced too? Your heart and brain need a break, both during intensive sessions and beyond. And here's why. Intensive therapy sessions can be emotionally draining for both the therapist and the client. Taking breaks allows you to recharge and maintain focus throughout the session, ensuring both parties can engage effectively in the therapeutic process. Therapists often deal with heavy emotional content during intensive therapy sessions. This could lead to burnout if you don't take adequate breaks to care for yourself. By taking breaks, you can prevent burnout and maintain emotional resilience, which is essential for providing quality care to your clients over the long term. Breaks help establish and maintain boundaries between the therapist and the client, ensuring that both parties have time for self-care and maintaining a healthy therapeutic relationship. Breaks provide an opportunity for both the therapist and the client to engage in self-care practices such as deep breathing, mindfulness exercises, or simply taking a walk. These practices can help individuals manage stress and anxiety and promote overall well-being.